I'm Dr. Anthony Maloof from Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video on your minor procedure. A minor procedure is something we do in the office. We don't use sedation. You're not going to have a general anaesthetic. A minor procedure also means that you can generally get back to work very soon, usually the next day. If you're having a minor procedure where I cut something, I've got to give you anaesthetic. Now you could be brave and we could do it using hypnosis. Wouldn't recommend it. But a minor anaesthetic means you get a needle, yes, ouch, a needle, and you get some anaesthetic, which stings. The anaesthetic does sting initially and then numb. People respond differently to pain, and you can tell a lot about people on how they respond to it. Most people are fine with it, but I'm going to give you a needle, numb the whole area. Sometimes I use stitches, sometimes I don't. If I'm cutting something out, I'll send it to pathology. It takes about a week for the results to come back. Afterwards, sometimes we patch your eye, sometimes we don't, and you'll probably have a bruise. Invent any story you like, shame anyone you want. I don't need to know about it, but you'll get a bruise. Bruises can last up to 2 weeks. What I do ask you to do after the procedure is use any ointments or drops that we prescribe, and I generally see you about 1 week. If you've got stitches in, they generally come out after about 1 week. On occasions, they do dissolve by themselves. If you've got any medical problems, bleeding problems, or at risk of infection, if you're on immune suppressant, make sure you tell me or remind me before we start. But aside from that, I rarely give antibiotics. So that's about it. Hope it all makes sense. Thanks for watching. I'm Dr. Anthony Maloof from Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.